Hello, this is Dr. Nathan Way, and today I'm going to be talking about amazing shoulder secrets revealed. Mostly about shoulder pain. And let's talk first about the structure of the shoulder. It's the largest, one of the largest joints in the body, very complex and highly mobile, meaning it can move around a lot. It consists of a number of bones, including the shoulder blade, the collarbone, and the upper arm bone. And the area of the shoulder that makes it so complex is this group of four muscles and tendons, which are called the rotator cuff. And the rotator cuff muscle and tendon group, the supraspinatus, infraspinatus, subscapularis, and teres minor, help to stabilize and help with movement of the shoulder joint. So when people have pain in the shoulder, it must be remembered that it's not always coming from the shoulder. Let me explain that. A lot of times, pain in the shoulder can be referred from other places, such as the neck. It's not uncommon for people who have osteoarthritis of the neck with a pinched nerve to have pain in the shoulder. Patients who have chest problems, such as pneumonia, can sometimes experience shoulder pain. Patients who have abdominal disorders, such as gallbladder disease, can sometimes feel pain in the shoulder. And finally, patients having heart attacks sometimes will notice pain present in the left shoulder. So just because somebody has shoulder pain doesn't necessarily mean that the shoulder is the problem. Now, true shoulder pain can be separated into three different categories. They are tendonitis and bursitis. They are injury and instability, and finally, arthritis. So what are some of the tips that we can offer here as far as how to take care of your shoulder if you have a shoulder problem? First of all, try to limit the number of overhead reaches you make, because when you lift your arm up to reach overhead, it actually pinches the rotator cuff between the humerus, the upper arm bone, and the shoulder blade, and that can cause problems with rotator cuff tendonitis over time. The same with repetitive motion. It's important to work on rotator cuff strengthening and range of motion. One should strive for correct posture. Wheelchair-bound patients might benefit from locking their arms close to their side when they're pushing on the wheels of their wheelchair to get moving. So how do you treat shoulder problems? Well, obviously, it depends on the diagnosis, whether it's a problem with the tendon, with the bursa, which are small fluid sacs that help cushion the joint, whether it's due to arthritis, or whether the shoulder pain, as mentioned earlier, is referred from another place. Anti-inflammatory medications, either oral or topical rub-ons, can sometimes be helpful for mild shoulder problems. Physical therapy is often used in people with shoulder problems. Steroid injection can sometimes be helpful, again, in patients who have relatively mild to moderate problems. And finally, in patients who have severe problems, complete rotator cuff tears, severe end-stage arthritis, may need surgery. And I want to caution here that you should see a surgeon, an orthopedic surgeon who specializes in shoulders. General orthopedists may not have the expertise needed to truly help with complicated shoulder problems, because, as I mentioned earlier, the shoulder is a very complicated joint. What's really exciting is that for tendonitis and bursitis, there's a new type of treatment called percutaneous needle tenotomy with platelet-rich plasma, PRP, and this is gaining more and more popularity as a treatment for soft tissue shoulder problems. And what we do here is, using ultrasound guidance and local anesthetic, we introduce a small needle And let's say, for instance, a patient has rotator cuff tendonitis. We'll use that small needle to fenestrate or create small holes in the damaged or diseased tendon. And this leads to acute inflammation, which is really what we want. And then we add the magic sauce, platelet-rich plasma, PRP. This is a concentrate of a patient's own blood that has a lot of platelets in it. Platelets are cells in the blood that contain tons of growth and healing factors. So what happens here is that once the acute inflammation is started, the platelets are stimulated to release these growth and healing factors, and that leads to the production, the creation of new healthy tendon tissue. And this is really a revolutionary approach to tendonitis that I think you'll find to be much more common as time goes on. Well, that's it for today. I'm going to wrap it up. This is Dr. Nathan Way again. Thanks a lot for watching.